Good afternoon. My name is Steve Geller, and I am the mayor of Broward County, Florida. At the conclusion of my remarks, about 5 minutes after that, I will do some brief remarks in Spanish for those of you that want remarks in Spanish, if you do want them. I want to begin by saying, please wear your masks. You've heard me say this before. You will continue to hear me say this. As I've said many times before, and as has been widely reported, the main issue with getting vaccinations into arms has been the vaccine supply. However, every week our vaccine supply has been increasing. There is good news on this front, as we have seen increasing supplies coming into the state and then flowing down to Broward County. It was recently announced that Florida will be receiving 542,850 doses, first doses, up from 492,850 last week. This number does not include the vaccine supplies at the 4 mass vaccination FEMA sites throughout the state. As you can see, the weekly supply of vaccine is steadily increasing. This will be the 8th straight week of increasing state vaccine doses. In January, the state was only receiving around 226,000 doses per week. And again, as I said, there have been federal sites added. Starting this week, Broward County will receive 58,320 first doses of vaccine. However, this number does not include Walmart, CVS, Publix, the amounts going to the hospitals, other pop-up sites, federal sites, etc. As of Tuesday, Broward had given the first dose of vaccine to about 465,000 people. I estimate that Broward has been vaccinating at a rate of more than 10,000 vaccine doses per day, first doses, 75,000 per week, 325,000 per month. However, we have seen acceleration. As I mentioned, 10,000 per day. The last 2 days, we have been vaccinating at a rate of over 15,000 per day. We are hoping that this number continues to increase. Again, we are expecting the Johnson & Johnson vaccines to come to Florida in about 2 weeks or so. I previously explained that I believe that about 1 million of Broward's residents will initially want the vaccine, which is based on approximately 2/3 of Broward's adult residents. With 465,000 residents receiving the first dose, are vaccinating somewhere between 10 and 15,000 people per day. It seems clear, if we go at 15,000 a day, that by about May 1st, every adult Broward resident that wants a vaccine should have received their initial shot. I expect our vaccination rate to start to slow down in mid-April, simply because there just won't be the lines. There may not be enough people to keep all of our vaccination sites busy by then, because just at the rate we're going, should be 800, 900,000 by then. I'm assuming that things are going to start to slow down as we get towards the end of April. The numbers that I've used predict a total percentage of people, as I've said, of about 65% or 2/3 that want the vaccine. That is based on national standards. But that's just not enough. In order to reach herd immunity, we need somewhere between 70 and 85% to be either vaccinated or have other immunity because they've already been exposed to COVID. At this point in time, medical science is not clear to what extent exposure to COVID will give you immunity sufficient for herd immunity. And we also don't know to what extent prior exposure to COVID will deal with the current variants that are out there. Again, I predict that by around late April or early May, instead of having too many people and not enough vaccine, we'll have enough vaccine but not enough people that want it. We need to start persuading the remaining people that haven't been vaccinated that they need to be vaccinated. There's been a lot of discussion between the county, our congressional delegation, and other stakeholders about bringing community groups and resources together. to educate people. As a result of these efforts, starting April 15th, about April 15th, the Health Foundation of Broward, in partnership with the Florida Department of Health in Broward, the Children's Service Council, the Broward County Office of Public Communications, and other stakeholders, will be launching a vaccine awareness and acceptance campaign to educate residents about COVID-19 vaccine safety and the importance of getting vaccinated in order to overcome vaccine hesitancy in the community. As I've said before, I expect we will need to be working with faith-based leaders. We will need to be working with our local municipal officials. We will need to figure out a way to work with male Trump voters, because the studies I've seen shows that there is a large hesitancy in that community about getting vaccinated. Regardless of your political beliefs, regardless of your political party, regardless of your ethnicity, we want everybody in Broward County to be vaccinated. After my last press conference, I sent a letter to the governor requesting that teachers, police officers, and firefighters be allowed to be vaccinated regardless of age. I'm pleased to say that apparently as a result of that letter, Broward County is now vaccinating all public school personnel, police officers, and firefighters of any age at all of the vaccine sites. As you may have already heard, the governor's made additional changes to the vaccine priority list. Effective March 22nd, the age for Floridians to receive the vaccine was reduced to 50, and effective next Monday, March 29th, that age will be reduced to 40. As I've learned this morning, the governor has announced that on Monday, April 5th, the vaccine will be available to all Floridians 18 and over. Many of you have asked me about Dade County reducing their age to 40. I've advised you previously, and I'm repeating, that I thought that the governor was going to reduce the age to 40 shortly. Miami-Dade has had to set up their own vaccine website in order to get this to people under 40, and I was expecting that the governor was going to be making this announcement by approximately the end of this month, which today's the 25th. I'm kind of right on time. I'm pleased to announce that the vaccination sites are now open in Pompano Beach and Hollywood. I've worked with the mayors of both cities. They have been complaining that they wanted vaccine sites in those two cities. Hollywood had one at TY Park, but that was only for educational personnel and first responders. The one in TY Park is now open to everybody, as is the one in Pompano Beach. And I might say everybody, I should say, that meets the governor's eligibility requirements, meaning Florida resident and the age. For those residents that are homebound, the Florida Department of Emergency Management has announced a vaccination program for homebound residents so that they can receive their vaccine at home. Residents can sign up by emailing homeboundvaccine@em.myflorida.com. Repeat, homeboundvaccine@em.myflorida.com, or by calling 866-779-6121. In addition, the Broward County TOPS program has also been providing transportation for homebound seniors to special vaccine sites. As of March 23rd, Broward County's percent positivity rate for COVID was 6.4%. The 3-day average right now remains over 6%. I can tell you that the numbers, despite the fact that we have vaccinated so many people, the numbers are trending upwards. And one of the reasons is people are assuming that the battle with COVID is over. It is not. Over half the states in the country have been trending upwards. Florida, I don't have the Florida numbers, but Broward County, our numbers have been trending upwards. So I am imploring you for a little while longer. Please keep wearing your masks and social distance. There is a light at the end of the tunnel. In another 2 to 3 months, I believe that if nothing bad happens because of the variants, if there is no interruption in our vaccine supply, I believe that in another 2 to 3 months, we will be mostly out of the crisis we're in now. It would be a tragedy if Broward County residents were hospitalized or died because they couldn't wait another month or two to socialize or take off their masks. Let me discuss spring break. I'm sure you've all seen the news about Miami Beach and the spring breakers. I've been checking at least once a day, generally more than that, with our county code enforcement and county administration about whether Broward County is having any spring break enforcement issues. I know that the mayor of Fort Lauderdale has been having similar daily conversations with his staff. We have not seen any problems like what has been going on in Miami-Dade County. I have been asked if the county is planning on initiating a curfew like Miami-Dade is. We are not. Both Fort Lauderdale and Broward County are watching the situation closely and are ready to take immediate action if it becomes a problem. I will tell you that the city of Fort Lauderdale and Broward County have both been getting out the message to the bars and restaurants that although the governor's order did waive then existing fines, there is nothing in the governor's order that prevents us from shutting down businesses that violate our COVID rules. We have not had to do that. We don't intend to do that. We intend to get compliance, however. And with both the urging of the city of Fort Lauderdale and Broward County, we have found the business community in Broward County has been responsive and responsible. I would also like to particularly thank the city of Hollywood for their efforts. Sorry, my glasses keep fogging up. And I did spray them with that anti-fog thing. It doesn't do anything. Let me say that Mayor Gelber of Miami Beach is an old friend of mine. He was the House Democratic leader when I was the Senate Democratic leader. Mayor Gelber has stated publicly that the majority of the Miami Beach spring breakers are over the age of 25 and are not college students. In Broward, we've been informed that the majority of our spring breakers are primarily college students and younger than 25. In fact, the biggest issue that we seem to be having is that many of them are under the age of 21 and are therefore too young to drink legally. Additionally, Miami Beach has seized more than 100 guns. I have not heard of any weapons being seized from spring breakers in Broward. I have asked. Now, it certainly is possible if there are a few people down here that were not identified as spring breakers and may have had weapons seized, but I have asked and been told that we are not aware of any weapons being seized from spring breakers in Broward. However, as I have said, the mayors, both myself and the mayors of our coastal cities, are constantly checking on this. Let me discuss the reopening of Broward County. We can't expect that our business community, our bars and restaurants especially, can keep up with limited occupancy indefinitely. As more of our residents are being vaccinated, there will come a point in time that we're going to need to start loosening our emergency COVID restrictions and then eventually fully reopen Broward County. As I informed you at the last press conference, at the next commission meeting on April 6th, I will be bringing up a plan for discussing the county's plan to eventually reopen. Additionally, at the same meeting, April 6th, we will discuss our plan to reopen our county commission meetings to the public. As I've said before, it is important that we have a plan in place that is not based on arbitrary dates, but is based on science and metrics. As a follow-up to the discussion that I had with Dr. Fauci, and to follow up to the conversations that I had with the 10 representatives of the CDC, the 4 representatives of federal HHS, the Dr. Thatchy, who is the Broward County Director of the Florida Department of Health in Broward and the head epidemiologist for the state of Florida. I have sent a letter to all of those attendees, including what I thought was an appropriate metrics-based approach, and I am expecting I will be hearing back from them soon. I have requested that I hear back from them by next Thursday. They are the scientists and experts, and I'm looking forward to hearing their opinion. The letter that I sent to Dr. Fauci and the CDC, including the following proposals. However, let me emphasize that this is what I am suggesting, that if the CDC comes back and makes some suggested alterations, I personally would agree with whatever changes they are recommending. Additionally, there's no guarantee that the commission will adopt all of these. There are 9 smart, independent elected commissioners, and certainly they may have some suggestions for changes. We would eliminate the restrictions in 3 phases. The first phase would begin after Broward County has reached a 50% vaccination rate and has a COVID-19 positivity rate under 5% for more than 10 consecutive days. The following emergency COVID-19 restrictions would be lifted upon entering phase 1. Again, this is my recommendation. Lifting of the 6-foot social distancing restrictions at our hotels. Lifting of capacity limits and 6-foot social distance restrictions on outside gatherings. Listing of capacity limits and 6-foot social distancing restrictions on outdoor, non-professional organized sports with spectators. The state has preempted the field on professional sports. Lifting of capacity limits and 6-foot social distancing requirements at restaurants. Lifting of capacity limits and 6-foot social distancing requirements at function spaces. Lifting of capacity limits on charter boats, lifting of capacity limits on retail establishments, and lifting of capacity limits on gatherings in private residences. The second phase, phase 2, would begin after Broward County has reached a 60% vaccination rate and a COVID-19 positivity rate under 4% for more than 10 consecutive days. The following emergency COVID restrictions would be lifted upon entering phase 2. Lifting of capacity limits and 6-foot social distancing requirements at bars. Lifting of capacity limits and 6-foot social distancing restrictions in commercial gyms and fitness centers. Lifting of capacity limits and 6-foot social distancing restrictions on bowling alleys, arcades, and indoor amusement facilities. Lifting of capacity limits on movie theaters, auditoriums, playhouses, concert halls, museums, and parimutuel establishments. Lifting of capacity limits on pools, community rooms, fitness centers, and gyms in housing developments, and lifting of capacity limits on vacation rentals. Let me say, when I'm saying lifting of capacity limits, I am referring to government-mandated capacity limits. Certainly, individual businesses can still continue to have whatever capacity limits they wish, as can housing developments. The third and final phase would begin after Broward County has reached a 65% vaccination rate and a COVID-19 positivity rate under 2.5% or 3% for more than 10 consecutive days. Upon reaching the third phase, Broward County would eliminate all remaining mask mandates. And this would include lifting of all face mask requirements and lifting of all other COVID-19 restrictions. Please note, as part of the above proposal, if the county COVID positivity rate goes above the thresholds to reduce them, if it goes above those numbers for a period of several days, then we would revert to our existing orders. Let me discuss the American Rescue Plan, which was recently signed by President Biden. Under that plan, Broward County should be receiving 378.73 million directly. The cities in Broward County should be receiving 422.39 million for a total funding into Broward County between our cities and the county of 801.12 million. The first tranche of this would be 50%, and that would be in the next few weeks, followed by the remaining 50% approximately 12 months after that. While the county is waiting on federal guidelines as to how the money can be spent, there is concern that the limits will be too strict. Therefore, we are working with our congressional delegation to ask for flexibility as to how the county can spend those funds. For those Broward residents who are in need of rental assistance, the county is offering a program through the American Rescue Plan Act to eligible residents who make under 80% of the county's median income. We have hired a company, or are in the process of hiring a company to administer that. We have chosen from among 6 applicants 4 people that actually submitted. We have chosen the vendor, and today or tomorrow, the contract will be going out to them. I am expecting by the end of the next week, there will be a signed contract so we can begin that. The county also has programs for people that earn over 80% or whose problems are not necessarily COVID related. So for information on both programs for rental assistance, please call the county's Family Services Division at 954-357-6367. Before I finish the press conference, the last item I wanted to discuss was to briefly talk about the tragic crash that occurred at North Perry Airport last week. This was a tragic accident which resulted in the loss of life of the 2 on board the plane which crashed and a child in the vehicle which the plane struck. I have asked the airport director, Mark Gale, to review 10 years worth of incidents at the airport, which I believe he has done. I've asked him to go into details on this to determine what has been the causes of the crash. It appears that the overwhelming majority of the crashes have been based on mechanical error. While we are waiting for the results of the official investigation as to this crash from the National Transportation Safety Board, we are reviewing what the county can do that is not preempted by the FAA. Again, if the problem appears to be mostly mechanical in most cases, we want to find out, are there things we can do to tighten standards on mechanics or planes that are flying out of there? Again, we think that many of these may be preempted by the FAA, but we are happy to work with our congressional delegation and the FAA to see if we can make any changes in this area. That concludes today's press conference, and I'll be happy to take any questions once I can see you.
Mayor Ted Scouten from CBS4.
Hi, Ted.
Can you please talk about your reaction to the governor lowering the eligibility rate and really what that means for Broward County going forward?
I've been expecting that the governor was going to be lowering the rate simply because when you consider how many people Broward has vaccinated and the amount of people that we have left to vaccinate, I expect within the next 5 or 6 weeks, we will have vaccinated every adult that wants a vaccine. If the governor did not reduce the rate, we would be running out of people to vaccinate. So I've been predicting that sometime around April 1st, the governor would be reducing it to 40. I was predicting that by mid-April, he'd be reducing it to everybody, and apparently he's doing that at the beginning of April. I stand by my prior remarks that I think everybody in Broward that wants to be vaccinated should be vaccinated by beginning of May. Are there any additional questions? Another one.
One other question.
Sure.
You talked a lot about the numbers in terms of how Broward is doing. When you look at it overall, are you pleased with the way things are going? Are you concerned? Just what is your thought on the state of vaccination in Broward?
I am pleased with the way it is going. I have spoken as recently as today with Dr. Paula Facci, the head of the Florida Department of Health. She went through our numbers in terms of comparison to the rest of the state. In every metric, in every age group she mentioned, Broward County is ahead of the statewide average in terms of people over 65, in the terms of people in each and every age group, including total vaccination rate. Broward County leads the statewide average fairly substantially. So I am pleased with the way that it has been handled in Broward County. As I said, I'm expecting everybody that wants a vaccine will get one soon by give or take beginning of May. I really think our problem is we need to start persuading people that they need to get vaccines. There are just too many people. We will not reach herd immunity at a 65% vaccination rate. We will need more than that. And I'm hoping that we will be able to persuade everybody to get vaccinated. Are there any additional questions?
Yes, really quickly, if you could go over, because there was a lot of numbers, you said as far as the different phases and lifting capacity limits and social distancing.
I
could you-
apologize. I can't hear you. Can you repeat?
Can you hear me now?
Yeah.
Yeah. What was that, that rate that you said that restrictions would stay in place if the positivity rate went back up? What was that number?
There wasn't. Because, again, I'm still waiting for guidance. But what I'm saying is let's say we cross from below the 5% threshold to the 4% threshold. So we're now below 4%. So that would eliminate everything except for face masks. But then if we go back over 4%, 4.5%, let's say, for a period of where the 3-day rolling average is over 4%, some of the restrictions that came off would automatically pop back into place. But I'm waiting for guidance from the CDC on this. My glasses weren't fogging when I was in my office. Something about this chair. Are there additional questions? Are there any additional questions? Don't say I never answer your questions. All right, going. Yes, sir.
Do you speak Spanish?
Esta es una buena pregunta. En realidad yo hablo tan bueno que es necesario para conversar, pero no tan bueno que es necesario para answer questions for an interview. I have remarks in Spanish that I will read. And I will do that in a few moments. Any additional questions? If not, thank you for being here today.
Thank you.
Bye.